Hello, guys. Thank you for watching today. It's a privilege to be able to discuss with you again, and I'm excited about it. Today, I'll be talking about what to do about those very terrible headaches when they do happen. Those headaches that happen that keep appear to be going on for several hours, running into days, and not getting better. In this day and era, you'd agree with me that with all of the information available and with all of the, you know, possible strategies that can be used to improve the lot of those who suffer recurrent headaches, it's not acceptable for people to suffer headaches that last hours, several hours, and runs into days. It's usually very heartbreaking. Sometimes you see patients coming to the clinics and complaining about headaches that have been going on for several days on end. So this is what this video is about. What strategies can you employ to help you handle these headaches and terminate the headaches in time so that it doesn't take away your day from you. So I would like to welcome those of you who've been watching regularly on this channel, and thank you very much for taking your time to watch. Thank you for your comments and your support. And for those watching for the very first time, this is Brain Gist. This is where we talk about the brain, many disorders that affect the brain, including headaches, epilepsy, dizziness, and so many other things, how best to cope with these disorders and not necessarily allow them to, cause any disability or affect your daily living significantly. And if you do not suffer any of these disorders, you care for people who got them, you can also find this channel beneficial. So I encourage you to please subscribe if you haven't. So going back to the topic of today, that's how to best deal with those moments when you have those terrible and disabling headaches. I think the first and foremost thing is that there has to be an action plan on how to handle these headaches. So when you have a consultation with your doctors about headaches and they've told you you've got migraine, there has to be a properly formulated, clearly written, step-by-step plan on how to deal with your headache attacks. That's extremely important. And that's the only way you can prevent or avoid those kinds of headaches that would last many days. So what I tend to do in my own case is when I have patients who've got these kinds of headaches, we put pen to paper, we sit down together, and we work out what we think is the best way to handle those headaches. So it's a shared decision-making process. So what I tend to do a lot of times is to help the patients to understand that the various kinds of headaches they could have during their migraine attacks are of possibly 3 different levels. You could have mild headaches, moderate headaches, and severe headaches. And I help them to understand what mild headaches are. So if you rate headache severity on a scale of 0 to 10, so those headaches they rate anywhere between 1 and probably 5, I would think those are mild headaches. And when those happen, the medications you use could also, be matched to that level of headache. So I also tend to divide the medications that work against headaches in those 3 categories. So those medications that work with mild, effectiveness or efficacy, and then those with moderate efficacy and those with very high level of efficacy. So tend to match them and help them to identify those medications. Quite a lot of people use Panadol for their headaches. So, but interestingly, I sometimes find out that people who are adults or older than 12 use just 1 tablet of Panadol, but that may not work all the time. The right dose should be 2 tablets. So we talk about these things, and those can be used for mild headaches, for example. And let's say you've taken your Panadol, for example, or whatever else you agree with your doctor as your medication strategy for your mild headaches. Whatever medication you've taken, within 2 hours, you should have a resolution of those headaches. You should not continue to have headaches going on and on beyond 2 hours. Whatever headaches last beyond 2 hours, of taking a medication shows that that medication hasn't worked, and that is the time for you to step up to the next level of medication. So, and then that level of medication will be the moderately effective medication. And even when that is taken, usually within 2 hours of taking it, the headaches should improve somewhat. And if it doesn't improve, then you might need to escalate to the third level. And then sometimes we also ask people to combine strategies. For example, you've taken your Panadol for your low grade headache, and then after 2 hours your headache is still going on, then you can move on to the moderate level medication. You've taken that another 2 hours, the headache is still going on, so the third level can be taken, or you can combine medications from those three levels, and that improves your chances of success. Of course, occasionally there might be times when you would have those attacks are terrible and you've tried all those strategies and it doesn't appear that they're working. So on those very rare occasions, you might need your physician's help to get some infusions to get better. Now, the other thing that we tend to talk about in the clinics are issues around how quickly do these headaches tend to peak when they happen. So occasionally my patients tell me for some of their headaches, they wake up and realize the headache is already established. So that kind of scenario does not give you time to start relying on tablet, because it takes time for the tablet to get absorbed and start to work. So in that situation where the headache is already probably started when you were sleeping, and now you're awake and your head is already pounding and you got that terrible headache, so you need to have medications that can work pretty quickly in the order of minutes. And that's where medications that can be, inhaled, like nasal spray, work. So there are medications these days, especially in many countries, like in UAE, we've got those sorts of medications that you can spray through your nose that can help you abort the headache. And then there are also injectable medications which can be used, and many of them are patient friendly. They can be injected by the patient. It's just like a pen that you just position on your thigh or on your arm, and then you press it, and within a few minutes the headache is aborted. So all of those strategies need to be discussed in the clinic, and that's what I tend to do. We discuss all the strategies, even write them down and send it in an email format to the patient so they can refer to it and revise it, so that when they have headaches they know what to do. And also there are these days those tablets that you don't have to swallow, they just put on your tongue and lick like a candy, and it tends to disperse within the mouth and work within 15-20 minutes. So those kinds of medications are useful for those kinds of headaches. And occasionally there are times when you have headaches with troubling nausea and vomiting. So in those situations, you may not be able to rely on tablets because of vomiting and nausea. So that's when some of those formulations come in handy, those kind of medications that you can spray through your nose, and they work pretty quickly, or the one you put on your tongue and it gets absorbed from there and gets you relief within minutes, or the injections. So every patient needs to discuss all these options with their doctors. So there has to be a clearly defined plan written out on how to handle each of your headaches, starting from whether they are mild to whether they are moderate or whether they are severe. And then medications are matched to each category of headache, and whether they come on rapidly or they come on rather slowly, allowing you time for you to take the medications. And you need to know, the names of the medications, how often they can be repeated, and how you can combine them safely, without side effects and all of that. And the last thing to say is that some of those headaches are associated with other things. Occasionally, there is a lot of light sensitivity and sound sensitivity coming with the headaches. And when this happens, this will be the time for you to take your medications, shut down the curtains, withdraw from, bright environment. You can lie down in a quiet place, or, away from sound and noise, and allow time for your medications to work. If you're dehydrated, you could take some fluid, and you could try to relax, meditate, do breathing exercises, and hopefully the headache should resolve. So I hope you found this video useful. And I hope this would prompt you to be able to raise fruitful discussions with your headache doctor when next you see him or her, so you can discuss the right strategies for your headaches, because it's really not correct for anyone in this day and age to have headaches lasting hours, lasting days. All right, if you found this useful, I encourage you to please subscribe if you haven't, and share with your friends, colleagues, and family, and drop your comments in the box so I can know you've seen it and you found it useful. Thank you so much for watching today, and I'll see you in my next video. Bye and stay safe.